Hey everybody, this is Dr. Ed Gigliotti. Today I want to show you a really cool case that just reinforces the fact of why getting the necessary x-rays, MRIs, CBCTs are so imperative for you to receive the care you deserve and to get solid answers to your health challenges. This individual started care here just recently, and the major complaint was left shoulder pain with carpal tunnel. Okay? There was nothing else that was a major red flag. He was diagnosed with polymyalgia rheumatica, which is inflammation of, usually it's the shoulders and the hips. It's an inflammation condition. And a lot of times people report that it's like flu-like symptoms and you could get pain and tenderness in those joints. But other than that, nothing else. We did our upper cervical chiropractic exam, and it was indicating that there was definite neurological stress occurring in the atlas level. Okay, that is so important because, as you may already know, brain controls everything in the human body, and the lowest part of your brain comes down to the atlas level. Okay, and that's called the brainstem. The lowest part of the brainstem is called the medulla oblongata, and literally comes down to here. So the brain, brainstem, and spinal cord control virtually every function within us. That is why at this office, we don't do anything else. We are strictly hyper-focused on how is that central nervous system operating from a chiropractic perspective, and is there any vertebra that have malpositioned, putting pressure on that system that could be disrupting or distorting the communication pathways from brain to body. Your brain, brainstem, and spinal cord control every function within you, virtually every function. That's why we're so passionate about this work. So this here is a image from behind. This is actually 3D software, so look how cool this is. You can like spin it. This is what we have in our office. Okay, this is the back of his skull, the atlas vertebra, as I told you why it's so important with the brainstem coming through there. And then here's all the spinal levels. Okay, when we did the analysis on this imaging, and by the way, we also sent out this imaging to a chiropractic radiologist who gets a whole medical perspective on it that we can now send to his specialist and his medical doctor. So that way they have this very important information to care for him better too. So when we did the analysis, something stood out right away. I want to show you this. So this is going to be the left side of his face and his neck. So there's his teeth there. Okay. And I'm going to pull up my imaging just so you could see as a comparison on what mine looks like in the average person. So this is mine, okay? Now, if you look here, here's the atlas vertebra, C2, C3, C4, C5, C6. And look at the spaces in between the vertebra. There would be tissue in between called the disc, the intervertebral disc, right? That's why there's a space in between, because it's like a cushion, like a shock absorber in between. Now, look at this gentleman when we look at his from the side. Look how it looks like one solid bone, okay? The reason why it looks like one solid bone is because it is one solid bone. This here is a side view of his head and neck. And I want to show you this. There's his dental work. Okay, there's jaw. And then if you look at this here, look at this. This is the atlas vertebra, C2, C3, C4, C5, C6. Look at this white, like this white matter here on the imaging. Okay, and I'll just change the contrast a little bit. 1 second here. Okay. What this is here is it's called DISH, okay? DISH is a condition that occurs when the body naturally just starts laying down calcification. So it starts laying down bone over the course of months to years to decades, and it actually fuses these segments together. Look at that. So if we didn't take this imaging, if we just went, oh, well, it feels okay, because you wouldn't be able to feel this. If we just did, oh, you lost a little bit of your motion in your neck, but it's okay. No pain, no tenderness, okay. And we tried giving specific upper cervical care here, we would have missed it. We would have probably been trying to adjust this without the proper testing, which we wouldn't do. We always get the proper testing. But we would have been trying to adjust this when these segments will not move. They are all fused together naturally. Okay? Just for comparison, look, this is my imaging. This is what it should look like. Look at the space in between, space in between, space in between, space in between. And look at this. Look at that. How crazy is that? Now, here's the good news. Because we got this imaging, We know what not to adjust, which is very important. And we also know what we can adjust. The atlas vertebra was way forward on the left side on this gentleman, way forward. So even though that these were all fused together with that condition called dish, okay, this was way out of adjustment, and it can be addressed. We can open up that canal from the top down with very gentle adjusting, help the body do that. So that brain to body communication can still improve even with these adaptations that have occurred below. This is why imaging is so important. Okay, you can't feel this. You can't see it from outside their skin. If we didn't have the proper testing and we didn't know to take the proper testing in this case, we would have missed this like probably so many people prior, because he's been having these issues now for a very long time, decades, and no one's been able to get to the bottom of it. So love and appreciate you guys. If you guys are looking for a closer look at your health, on what's going on with you and your family, it'd be our pleasure to do an assessment and see if you're a candidate for care and if we can help. We help people from all over with all different health issues because the central nervous system controls everything. But there's a high correlation of headaches, migraines, and vertigo. People coming from all over and receiving care and noticing like drastic changes with their life when it comes to upper cervical chiropractic care in those conditions. Okay? So love and appreciate you. If this makes sense or resonates with you, or you know somebody that needs to hear this message, please share it with them. Thank you.